Good afternoon, everyone. My name is Brigitte Daniel, and I'm the Executive Vice President of Wilco Electronic Systems, as well as the founder of Mogulette. And on behalf of this impactful collaboration, I'd like to welcome you all to the 6th Annual Women in Tech Soiree Launch Lane Showcase 2020 edition, Digital Health Innovation. That's our focus. And we're just delighted to have you here and share your time this afternoon and evening in coming together, particularly for this 2020 year. It's definitely been a year for all of us. It's definitely marked a shift in our world, our culture, the future of how we will literally live, work, and play as it relates to our health and the economy, and the absolute need for our country to really start dealing with racial injustice. So it just kind of seems like we are at this universal, generational, cataclysmic tipping point in the history of mankind. There's these moments in time that define generations, and it seems like we're in one. We are in a moment. So this event tonight is very special because it'll help to bring the light to some of the disparities and the issues that we all been dealing with this year, but also be inspiring. So we can look forward together, particularly as it relates to how we become stronger as a region and a nation. Because this year, the focus was for digital health innovation. And of course, that's for very obvious reasons, just because health is at the priority for everyone's agenda completely. But for those who don't know, Philadelphia is one of the key cities in the nation, really revolutionizing the life science and biotech digital health sectors. I mean, literally, it was just published in Philadelphia Magazine by our dear Queen Muse. Thank you, Queen, that Philadelphia's life sciences sector is right about where Michael Jordan was in 1989. And this is her analogy. I'm just using it to expand what that means. But for all those who are like in sports history, and my husband will definitely know what this is, I'm channeling him right now. 1989 was like the breakout year for Michael Jordan. And it was one like he scored all those like history winning shots, and he was like the star. And this was before he became like the three-peat champion, before the dynasty. Like 1989 was the year where everybody knew, oh, this guy is going to be the guy of basketball for the future. He is it. And everyone just started taking notice. What the article said, that's where Philadelphia is right now. We are in our 1989 moment. We are the epitome and the crux of what Philadelphia biotech life science will be for the country, the nation. And that should kind of give you some tingles because if you are, looking at it, I mean, you can even see where like the vaccines were, like even for Pfizer and Moderna, a lot of those Philadelphia participants who were part of those projects were from the academia institutions of UPenn and just other different kinds of companies that have been in the region. So this is a very big deal. I mean, that vaccine, I believe, is getting probably FDA approval literally right now. I believe that they're voting on it today. So Philadelphia is really on the map. We are becoming a part of the whole niche national conversation. So that's why tonight makes it more so integral in a moment, because we're celebrating, we're being retrospective, we're going to be introspective, we're going to look forward, and we're going to do with the people that absolutely are helping to put all this together. So we're proud to have our stellar speakers, Dr. Ayla Stanford, Joel Burke-Solomon, Melissa Hanna, State Representative Morgan Cephas, and we're super excited to debut our inaugural Launch Lane cohort. They are just really such an exceptional group of entrepreneurs. We've got to know them for many, many months during a very unprecedented year, and they're all coming out of this accelerator, Launch Lane, all of them, ready, scalable, and primed for impactful growth, like in this explosive digital health innovation sector. So we're so excited for you to meet them, and we're happy that you're here, and we welcome you. So on that note, we have a very tight night. A lot is being packed in, so we're going to move swiftly. I'm going to also reiterate a couple little housekeeping that Natalie just was able to share. So we're using two platforms. That means like we are literally using one for content, Zoom, and the other Remo platform we use for the virtual networking. Please feel free to mix and mingle. We'll have that Remo chat in the, that link will be in the chat box. So please, if you know how to use chat, it's at the bottom. As Natalie said, you can totally go there and go to Remo during the networking, or if you want to stay for content, that's great. But there'll be definitely times that we'll encourage Remo to go over there. All the guests will be in listen mode, so you will not be have to worry about your mics. And again, if you have any questions, technical difficulties, anything that comes up, please put it in the chat. We have a great production team, and they're working, like looking at that particular chat box constantly. Let's see, we do have a hashtag. It is hashtag Launch Lane Soiree. So if you are interested in documenting and just either posting or tagging this event, we would love for you to do it. We're on Instagram as well as Twitter, but the Launch Lane, hashtag Launch Lane Soiree will totally be used, and we would love to see as many social media mentions. Just real quick, there is an agenda. I just want to quickly go over it so everybody kind of understands where we're going with. After we have our opening remarks from some other great partners, we'll have Dr. Ayla Stanford. She'll be speaking at 4:20. We'll also have at 5:30 the Launch Lane panel moderated by Jill Burke-Solomon, and they'll have a special introduction to that panel by our Science Center Tiffany Wilson, CEO. And before that, we'll have a 15-minute intermission. So just want to say before that panel, there will be a 15-minute intermission where we'll have the videos of the Launch Lane panel. Please stay for them. They work so hard and those videos are awesome. So after that panel, people can be encouraged to go to Remo. That'll be probably around 6:50 to 7 o'clock-ish. And then at 7:10-ish, but around really 7:10, we'll have our final panel with Melissa Hanna and PA State Representative Morgan Cephas. And then there'll be another intermission, and then we'll have this after dark concert, which is awesome. And that will be with the indomitable, beautiful Soiree Nicole, and she'll be kind of ending the night for us with her very, very cool sounds. So again, without further ado, we have some great partners that would love to share some remarks. I'd like to introduce a few of them. The first one is Aron Starosta. He actually is our fearless leader and the director of Launch Lane. But he actually is also commonly known as an architect of accelerators. He's done it here, across the country, across the globe. He is the real deal for this. And he now is the recently appointed Vice President of Commercialization New Ventures. So now he has to wear a suit, which I can't wait, but I've been enjoying working with him. He has been one of my career highlights in the last couple of years, and we're very excited for you, Aron. So thank you so much for sharing some remarks here today. And you're on mute.
That's what I get for trying to be respectful, right? Well, thank you, Brigitte. I appreciate the intro, and good afternoon, everyone. Though these days with daylight savings, I guess I feel like I should be saying good evening.
I know. Yes, I'm about to stay in a minute.
Yeah, exactly. But I'm thrilled to be here today, and for a number of reasons, actually. Because first, it's going to be a fantastic program. I'm very excited about it. The teams we have here in this round of the Launch Lane are exceptional and a really impressive group. And I've been honored to work with them over the last year. Typically, these things only last. We only do the active programming for 4 or 5 months, and we've pretty much done active programming every single week now for the companies, just to get them through COVID and build this community. And as a result, it's felt a lot more like family. It's always felt like a close-knit group, but this year's felt like a lot more like family than some of the previous ones, because we spent so much time together. But anyway, I suspect you're all tuned in right now because you already know it's going to be a great program. So welcome, everyone. The second reason that I'm excited to be here today is that as a week into my new role as Vice President of Commercialization and New Ventures at the Science Center, as Brigitte just pointed out, and I'm delighted not only to represent such a venerable institution, but to do so at this Hallmark Philadelphia event rooted in what I am most passionate about. Elevating the work of diverse founders, collectively building a better future for Philadelphia and beyond. So I think this is a great forum for that. And so thank you, Brigitte, again, for putting that together. Despite my short tenure at the Science Center, this work is not new to me. For the last year, I've been working with the Launch Lane companies that you'll hear from today. And before that, that you'll hear from today and before that, and have worked alongside the Science Center's commercialization team over the last several years to build the digital health accelerator, now known as the Launch Lane Digital Health, which, and I'm going to make a shameless plug here, is now accepting applications. So if anybody is interested in having $50,000 for their startup, it's a one-page application. It's due the 21st of December. There is still time. It's not too difficult. And once you see the companies that are here today, you'll know just exactly how valuable the program is. Hopefully they'll tell you, but I'm going to tell you right now that they have come so far and done so much. I'm really proud of them. And so for those not familiar with the Science Center suite of commercialization programs, they're designed to provide the right help at the right time for those promising startups and founders looking to advance their ideas and scale their companies. So we're eager for you to hear from the 7 of them later in today's program. And thank you again for having me here today. And I hope to have an opportunity to interact with many of you later in the program. So thank you.
Thank you, Aron. Absolutely. We're excited and absolutely want to reiterate, launch lane applications for the next cohort. Cohort 2, how about that, is accepting applications. Deadline extended December 21st. Absolutely. This is worldwide application now. We're not just looking at Philadelphia, we're looking at everybody because we're still going to be virtual in 2021. So please, please, please definitely take a look. We'll have slides and there'll be a very interesting QR code that you can literally just snapshot and you can absolutely get the application. It's very simple. We'd love to have you join us here in Philadelphia. On that note, our next partner, who I absolutely love, Keenan, because I've known her for like the last couple of years. People call us a twin sometimes, which I'm actually honored about because she's just a beautiful person. But she is the new senior program manager at Comcast Universal, Lift Labs, and just about Comcast. Just want to say thank you again to the team, Delilah, Danielle, Monique. Everyone always comes on board, always just has a great time with us, and they always are supportive without a lot of questions asked. So thank you, Comcast. Thank you, Keenan. And we'd love to just have you share some remarks.
Wonderful. Thank you, Brigitte. Building an innovation ecosystem here in Philadelphia and beyond is so important to Lift Labs. So we're really thrilled to be supporting this program and a woman, you, who are doing just that with this year's Women in Tech Soiree. And I'm on Comcast NBCUniversal's Lift Labs team, and our team is meant to be the access point for startups who are looking to connect with Comcast, NBCUniversal, and Sky for inspiration, acceleration, and solving real business challenges. And so each year we identify focus areas for our work. And one that emerged as a timely theme in 2020 was the future of work. And the global pandemic has led to enormous shifts in how we live and connect. And many of the founders that we're working with at Lift Labs are building tools and services that will make work and life more accessible, efficient, and interactive. And as Brigitte mentioned in her introduction, the pandemic has also made more obvious deep inequalities based on race and gender in entrepreneurship, healthcare, and justice. And at Lift Labs, we're proud that nearly 70% of the founders in our Lift Labs and Farm Accelerator programs are from underrepresented backgrounds, which I think is a testament to the team's commitment to creating inclusive programs. And in 2021, we'll be launching and amplifying even more startup programs that support diversity, equity, and inclusion. And we're expanding partnerships with organizations like Black VC, Digital Undivided, and Reunion. So we hope that all of you tune in and participate wherever you can. So again, I'm so happy to be here representing Lift Labs. I'm really excited for this program and the amazing speakers that are lined up. So thank you, Brigitte, for having us.
Absolutely. Thank you, Keenan. And I love Digital Undivided. That was a great partnership. So I'm glad that's coming under your tenure. Go. Yeah, absolutely. Kudos. So I'd like to introduce another partner who has always been behind us in this, and particularly this movement and this event, Terry Booker from Independence Blue Cross. He's the Vice President of Corporate Development and Innovation at Independence Blue Cross. I will actually say Terry is one of the silent forces behind IBX, because I just met him like right before the COVID pandemic, and we were actually at the Science Center, and I didn't even know who this man was. And when I found out who he was, I was like, where have you been? Because what he does there is oversees the corporate growth through diversification efforts. That includes acquisitions, partnerships, affiliations, development of new companies. He leads the innovation efforts to find new ways of transforming healthcare by creating dynamic new models of care. He invests in powerful partnerships and nurtures health-related startups. Like, where have you been, sir? Love that you're here. Thank you so much, Terry. Would love to just have you share some remarks.
Absolutely. Thank you, Brigitte. It's fun to join and be a part of the innovation ecosystem. One of the things that I've been, very, very interested in and passionate about since about 2014, when Independence Blue Cross started its own innovation center and innovation efforts. And with that, we started to invest directly in companies that were strategically of interest to us. We started, along with the University of Pennsylvania, we were co-sponsors of the Dream It healthcare accelerator that we've done for 6 years, or that we did for 6 years rather. And it's also good just to see so many people that I've met over the years that are on this call just by looking around the different screens on the gallery view. So I would say that Independence is definitely happy to continue its relationship with Women in Technology. If there are things that you want to do relative to healthcare, and IBC can be a partner, or IBC can shed some light, please give me a call. I'll handle it personally and help to navigate you through our ecosystem that ultimately ends up with all of us getting hopefully decent healthcare. Thanks again, Brigitte.
Absolutely. And please give our regards to Michelle Histan and Dan Wipser from the awesome BPHL team. They become such a part of our own family of ecosystem growth. So you guys are really crushing it over there. Thank you so much, Terry. And I love Instamed. So I would love to introduce everyone to one of our actual key partners, our second-year partners, Deirdre, and I believe she is not coming up next. So it looks like we have Scott Nissenbaum, which is fine. Hi, Scott. We're rocking and rolling. So Scott actually is the president and chief operation officer of Ben Franklin in the Technology Partners. This is actually my first time meeting Scott. I've heard so much about him actually from over the years, but Scott is actually preceding, or actually he's succeeding Roseanne Rosenthal, who's actually been part of the BPFT for the last 25 years. So it's very, very cool that he's here to us. And one of the things that I love about, Ben Franklin Partners, they've been such a behind the scene force for startup growth. So even this spring, under Scott's tenure, Ben Franklin's investment group was able to vet and deploy $2 million in pandemic related support to 38 of its Philadelphia region portfolio companies in 6 weeks. In 6 weeks. That is impressive. You guys are doing the work. And in June, they organized and actually committed $150,000 to underrepresented founders through the Graduating Philly Startup Program. So you guys are absolutely a part of the ecosystem. Love that you're here and would love to have some remarks from you. Thank you, Scott.
Thanks, Bridget. Thanks for having me. We're thrilled to be a sponsor, and honestly, I couldn't be more excited to come here on the eve of trying to take over Ben Franklin from the legendary Roseanne Rosenthal, which, if you're not familiar, has built Ben Franklin over the last 25 years into what it is today. Hi, everyone, and thanks for having me. So if you're not familiar with Ben Franklin, I hope you will become, because we invest more than anybody else in this region, more than anyone else on the East Coast. We are the 9th most active seed investor in the country. We average about 50 investments per year, and the portfolio is about 250 companies. Interestingly enough, about 20% of our portfolio is led by women, and about, I think it's 22% is led by a person of color. And although we would absolutely have a goal to make those numbers substantially higher, we're pleased at the base that we're starting from, given the low numbers in technology in general. Interestingly enough, also our portfolio right now of these 250 companies, and keep in mind, these are all early stage, all technology based, and all within the 5-county region around Philadelphia. 100% of those companies align with the UN Development Sustainable Goals. And 56% of those, so more than half, meet actually 2 criteria. Some of those criteria, if you're not familiar with the UN, could be education, could be water, could be poverty. There's a whole host. But we're trying to chip away at some of the larger problems that pervade us. Along the way, over the last 20 years, we've had a number of programs, accelerated programs like our Pathways in partnership with Village Capital. And as Bridget stole a little of my thunder, but we recently partnered with PSL, Philadelphia Startup Leaders, to try to expand our reach deeper into the city of Philadelphia. And then finally, I'll just encourage each of you. We would love to hear about the launch lane companies, your companies. I'm going to throw in the chat box here a way in which you can understand not only do we provide capital and support, but we have a dozen programs like 40 VCs as follow-on investors, a mentoring program out of MIT, a long list of ways in which not only do we provide capital, but we provide capital, counsel, and connections to the companies, and would love to partner with the investors on this group moving forward, even more than we do already. So thank you for having me, and I look forward to a phenomenal event.
Thank you so much, Scott, and absolutely can't wait to work with you and meet you in person for that coffee that we were supposed to have, sir. So absolutely. And last but absolutely not least, Deirdre Ruttle. So I met Deirdre and the Instamed team about a year ago, and they've just been such a wonderful complement to what we do. And I just want to say they are absolutely now a JP Morgan company. So if you see the logo and it does not have that, know that they are that. That's a big deal for their company. That means people were definitely highlighted and did a lot of work to make that happen. Deirdre was one of those people. She's the chief marketing officer at Instamed and heads of wholesale payments and healthcare marketing. And her experience and expertise includes a deep focus in healthcare payment research. And as you'll see, there is a healthcare theme with a lot of the people that we work with, particularly right now. So thank you so much, Deirdre, for coming on and for supporting us. We'd love to have some remarks from you as well.
Sure, Brigitte, and your entire team, thank you so much for everything that you're doing today and really throughout the year. Instamed is so happy to be part of this event. 2020 has been a year like no other, and we believe that events like today are more important than ever. Instamed has built its platform focused on innovation and driving the digital future of healthcare payments for over 15 years. As we've worked closely with our customers throughout 2020, we've really tried to do everything possible to help them implement contactless payment strategies in light of the pandemic. And often we're doing that in a matter of days. We have seen tremendous acceleration in technology implementation and utilization this year within healthcare. We do see this as hopeful in light of everything that's happened this year that has been so challenging, and we really want to continue to build on that. So looking forward to a great program today, and thanks for having us. Thank you so much.
And again, there are so many partners that really help to make this event just truly collaborative and an exercise in village building. So we're also very thankful to Cozen Connor, the great leadership of Melinda Rudolph, who is one of the people that actually have been our judges for Launch Lane. She has been there from the start. So we're very excited for Cozen O'Connor's support this year. Rich Nucci at the Guru team. They came on board so quickly. They're the epitome of kind of like startup success for our region. Whenever you think of a startup that has made it, Guru was one of them. So thank you for supporting and making sure that you are part of our team. Definitely so thankful for Einstein Healthcare. They're a new partner this year under the leadership of Dixie Ann James. Love Dixie Ann, love what she's doing. She's the COO of a major health institution in the country. That is amazing. Thank you, Einstein, for coming on board. We're very excited. Also, the team at CSL Behring. I see Jasmine Bostic. Thank you, Jazz, for coming on board. Absolutely. JP Morgan Chase, the good folks at Linode and the Economy League. You all just made this year just so much more bearable and doable and inspiring. So we're very, very thankful. And again, none of this could be possible without the behind scenes team of the people that were very instrumental in helping to produce and pull this event together, because this is kind of a village, absolutely kind of adventure. So again, to the Science Center team, Aron, Eamon, Megan, Kristen, Tracy, Saul, thank you so much for coming on board and saying, we got you, let's do it. To my Launch Lane team, Tom, Liz, Alan, Nestor, thank you all. You guys have been there with us. We've been putting a lot of work in this year. So proud and honored to work with you all for the last year to bring this cohort. Thank you all. We've been steady, we've been rock steady, we've been doing it. And to my team from Mogulette this year, Catherine Sontag and Brianna Curidan, you both were the perfect complement needed to bring this all together. Absolutely would not have happened. Love you ladies. Thank you both. Thank you all. And lastly, and this is very important, this event is about celebrating digital health innovation during a time when healthcare is truly the priority of every agenda, every household table, every business, every restaurant we go to, every grocery store we're in, we are confronted with the need to have our health and to have our peace. And there's so many people that have been detrimentally impacted this year. So just a reminder that this event really truly is a donation and a campaign, and all the ticket donations are going to Black Doctors COVID Consortium. 100% of the ticket also donations are going to Black Doctors COVID Consortium. It has been revolutionary. They've been forward thinking. They're led by the amazing Dr. Ayla Stanford, who we'll hear from in a couple minutes, but please feel free to donate. The link is still open in Eventbrite, and it's available throughout the chat. I think there's probably at least like 7 chat that has that link. So if you're able to contribute, we would love it. That donation goes to a great cause, again, that we'll hear about. And it's definitely a very good time to do it for the holiday season and as we go into the winter new year. So on that note, I'd like to just bring Terry Booker back up because I do think Dr. Stanford has entered our event, which we're very excited. Yeah, she is. Oh, in her testing gear, kind of. So I'd love Terry to absolutely introduce Dr. Ayla. It just seems appropriate to have Independence Blue Cross have their words for what the work that she's doing. So thank you so much, Dr. Stanford. You can put your mute, and then Terry, definitely feel free to make introduce our loving person, our Dr. Stanford, to this wonderful crowd.
Yeah, absolutely. I think everybody here would have had to have been living under a rock if you have not heard of Dr. Stanford, Dr. Ayla Stanford. So I'm just going to read a little bit of this, and it's always interesting when you read the person's official biography and you know so much about them tangentially. You know their husband, you know all kinds of people around them, and then you see all of these great and fantastic things. So I'm just going to give the audience just a preview of the background of the person you're about to hear from. What she's done lately is just the last 15 minutes of what she's done in her career that we've already been able to take note of. But it's been a career as a practicing physician for over 20 years. Dr. Stanford is board certified by the American Board of Surgery in both pediatric and adult general surgery, and a healthcare advocate. She is the founder of the Black Doctors COVID Consortium, BDCC. The consortium was formed in response to the disproportionate number of African Americans being diagnosed and dying from coronavirus in Philadelphia, Pennsylvania, and the lack of swift intervention to mitigate disease spread. The mission of this consortium is to educate, provide advocacy, and barrier-free coronavirus testing in an effort to decrease the morbidity and mortality associated with the disease. Her research in basic science, clinical research, and public health have been published in peer-reviewed medical journals around the country. Dr. Stanford also serves as a medical correspondent. Now, there are about like 15 bullet points of stuff that I could mention about Dr. Stanford. I won't go through them all because she'll be embarrassed probably, but I'm going to let her get to it. Like me, she has three sons, so she has to be fantastic. So bring her highlight her block and let her talk.
Thank you, Terry. Hi, Dr. Stanford.
Hello, how are you?
How are you? So good to see you. I know, so just for everybody knows, Dr. Stanford literally had to get pulled away from testing at Mastery Charter School, which I think I've even sent about 20 people there to see you today. I've been there a couple of times in the last couple months. You have been a lifesaver for so many people, but I just want to say we're just so thankful and grateful that you're able to take a little bit of time to share your work, because I know you are literally right deep in the work right now.
Yeah.
So
There's lots of folks outside lined up. I'm always grateful for sunny days in the winter.
Yes.
And because, we're in neighborhoods, people basically can walk from their house, walk around the corner to come, but then we struggle with, they don't have shelter in their cars. So we try to get those folks done as quickly as possible before it gets colder and before the sun goes down, so they're not standing outside.
Right. No. Well, I understand. We're not going to even make this too long so you can get back to the people. But a couple of facts. I mean, I think that you're at 19,000 probably plus that have been tested so far by BDCC. I know that there's about 4 million plus in funding. Definitely could use a lot more that you've probably received.
4 million.
No.
I don't have quite 4 million.
Okay. Well, that's what we're aiming for. That's what we're going.
Yeah.
That's what we're going.
Maybe 2. We've raised $2 million,
Okay.
which I think personally is fantastic. I said to the team, you know, writing lots of grants, having lots of conversations with people who are like-minded. You know, occasionally someone will just send us a check without any return address and no name on it. You know? So grateful for that too. So yeah, knock on wood.
I know.
Here.
And it's funny because, you know, so I sit beside you, I sit behind you in church. So I know you from Salem Baptist Church, we're church members. But when, you know, church was, of course, everything shut down in March, you know, you were probably one of the first people that just said, I have this idea. There's an issue, I need to actually solve it, particularly because the rates were so high. So, you know, since March, I think you've probably been like in literally almost 100 plus various media publications. You've been on Appearance, you've been on MSNBC, Ali Velshi loves you, Anderson Cooper loves you. Like, you are now one of the preeminent speakers and thinkers on this issue. And before we even get to that though, I would love to just hear a little bit about your background. North Philadelphia, born and raised, which is great. I mean, how do you become Dr. Ayla Stanford from like just being a Philadelphian as a little girl? Because there's not that many Black physicians that we even see, let alone woman physicians that we see with your pedigree and your long list of accolades that are doing this type of work just in the country.
Ooh, okay, well, thank you.
We're starting back, and then we're going to build up, because that's important for people to see, like where you've come to be where you are.
And I'm so glad you mentioned that, because for young people, you know, my children are fortunate that they have 2 parents and we both have, you know, stable jobs and good salaries. But my parents were teenagers. My dad, you know, left to go to Cheney. Most of the meals I received were from public school breakfast and lunch that I received. You know, I still remember cheese in the, you know, cardboard box. We, you know, used food stamps when they used to come in the coupon book.
Right.
I mean, that's my upbringing. And so what I would say to young people, and for those of you who mentor and around them, is it doesn't take your parents being Harvard, Yale trained and 6 figures for you to become a doctor. What I did receive from my parents, and especially my mother, was that anything that I could conceive in my mind, I could do.
Right.
So when I was young, like elementary school, I was writing Ayla Stanford, MD, Dr. Ayla Stanford as a young child. I was looking in the mirror with a white sheet and a stethoscope around my neck saying, "How are you today? I'm Dr. Stanford," you know? And I know my mom probably walked past the bathroom many times, like, my daughter is crazy, what's wrong with her? But and I know that she knows this now, but I never, ever doubted that I would be a physician. The other things were, they had the mentally gifted, academically talented program when I was in elementary school. So one day a week, I got to leave my neighborhood at the time, which was North Philly and then Germantown, and go to Drexel in West Philly. And just being on a college campus and watching, you know, these young, bright, energetic people, I was kind of like, wow, this is nice. I want to do this. And the neighborhood was so different than where I grew up. And, you know, we had these bags of tokens. And now as I look back, especially as we have a contract and we're testing all the SEPTA employees, as those tokens took me to places I wouldn't otherwise have seen.
Right.
Just taking the subway, getting off, walking up the steps, and being in a totally different environment. And once I got a taste of that, you know, kids that had nice clothes that weren't from the thrift store, you know, and not everybody took the bus, but you saw a Mercedes in the parking lot. I was kind of like, you know, as a young child, these are things that you notice. You don't, and here's the thing, you don't realize you're poor till you go someplace where everybody else has things you don't have. Right. And then you start thinking, well, how did they get that? You know? And for me, I was fortunate that I did well in science and math. And these MG and AT classes really pushed me. So again, I wasn't at, Springside Academy. I wasn't at Penn Charter. I was at Lingelbach on Lincoln Drive. I was at John B. Kelly. I was at Fitler Academic Plus School. And my brother went to Central. My mom got transferred with her job and I finished in New Jersey, but it was still, public schools. And what I would say is, it's really a belief in yourself, knowing your strengths and your weaknesses. Like I knew what my strengths were, and they were in science and math. I was very curious about that at a young age, and that propelled me. And I never doubted that I would become it. Now, my counselors did, my teachers did. They all tried to tell me I needed to go to community college and that my grades weren't high enough, my standardized scores weren't high enough. And I mean, the SAT is hard when people aren't saying, loquacious and taciturn and using big vocabulary words in your household. Like I had to study harder to catch up. But again, I was determined. So how you get to that from North Philly is, one, for kids, is getting out of the environment that you're in and seeing that there's an entire world out there, Right. And then you want that. I mean, I wanted that. Right. And then because I loved it, I was always intrigued by science. So I studied.
Right. So. But let me just say, because I have to Terry didn't do it, which I know why, because this list, but okay, coming from tokens to them being attending general surgery at Abington, Abington Surgical Center, St. Peter's University Hospital, Temple University, Abington Memorial Hospital, CHOP, having your own concierge, medical practice. I mean, the appointment, Dr. Stanford, that story, just from, and I didn't know your whole background, but just that story alone to all your accomplishments it doesn't happen. It really doesn't happen. And
at some point in your life, you realize your worth. And if you're fortunate enough in your lifetime, you realize it. Some people, unfortunately, go to the grave and they don't realize what they actually bring to the earth. And I started to realize that a little bit, again, as I got out of the hospital, just being out of the four walls of an institution and being in other circles. And people say, "Oh, you're a surgeon, really?" Kind of thing. And I was like, "Yeah, what's the big deal?" But to other people, they were, impressed by that. And about 4 years ago, I decided to start my own private practice. My kids were getting older, so I would have free time. And then the concierge practice was literally because someone said, "I need you to take care of VIP patient." I said, "All my patients are VIPs. What do you mean?" And I show up, and I don't think he'll mind this. And I show up at this undisclosed location out on the main line somewhere. And I'm sitting in this lobby, just like waiting. And then he walks in and he's like, "How you doing, Will Smith?"
So that was my next question, because I remember seeing the post when Will Smith did his 50-year-old plunge, did the skydiving, and you were there. You were his medical team,
and I was and I had been his doctor for some 8 years before that, and no one knew. I was at the hospital taking care of my patients, and then in my own free time, formed this consulting practice. The one thing I learned through that is, you could be rich in Black and poor in Black. A lot of times there's still health disparities, and you still need a health advocate. Absolutely. And that's what I ended up being for Will and his family. But in doing that, I started practicing medicine outside of the four walls of the hospital. So now I'm in Arizona, in the middle of the Grand Canyon, trying to figure out how to handle emergencies of dehydration and rattlesnakes and, someone tripping on a rock, or hypoxia, because we were so high above elevation that people were short of breath. And really having no four walls of the hospital. Also doing mission trips in Haiti, where we would bring things that people had donated and have to build a hospital in the middle of, and so at the time, I didn't realize that all these experiences were preparing me for something like this, but they were. And so to my point, as I was saying about, being a mentor, when I founded It Takes Philly, ironically, that's the name of my nonprofit, is It Takes Philly, meaning it takes the entire community to make things work. And it was It Takes Philly, encouraging and empowering our children to aim high. So I formed that almost 10 years ago, and partnering with the Philadelphia public school system and charter schools, exposing kids, getting them out of their neighborhoods to come to the hospital. You know, we went to Capitol Hill and they got to see the White House. The Philadelphia Inquirer invited the kids and they got to see what it was like to be a journalist. We went to Philadelphia Courthouse and judges brought the kids into their courtroom. I mean, so it was wonderful, but because I had that 501c3, because I had my consulting business, because I had my own private practice, when it came time and the pandemic hit in March, that we knew anyway, really December, November of 2019, but when it hit, I didn't need to borrow any infrastructure from any hospital because I already had it. For people who wanted to make, you know, donations in my nonprofit space, I had a reputable 501c3 that didn't just form because of the pandemic, but I had already been doing work in the community. So the Black Doctors Consortium became a initiative under It Takes Philly. In terms of testing people in the community, for folks that had insurance, you had to be in network with the different Aetna, Independence, Blue Cross, United Healthcare. Well, as a pediatric surgeon in private practice established, I was already in network with that. And then in terms of the consulting, knowing people that have more means, when they donated, it allowed me to then take care of the folks that didn't have insurance. So
everything coming together.
It all coming together, and it all goes back to knowing your worth. So if I was still working for CHOP, which was a wonderful experience as a pediatric surgeon, you know, being in a hospital where every possible invention, resource, medication, technique is at your fingertips, it was great. But there's no way I would have been able to do this working for CHOP or working for Abington. So I'm still on staff. Right. And I still operate there, and doctors still refer me patients, but I work for myself. And that's the autonomy that I could say in April, Black folks aren't getting tested enough. They're dying at a rate greater than anyone else. So I need people, I need testing kits, and I need to be able to get to them. Those are the only three things I need. And my phone, to reach out to all the doctors and nurses I knew and say, meet me here at this place. And that's basically what I did. So.
And I think that's what I started to see. I think so March happened, and then I believe the first time I heard about it was from our pastor, Dr. Marshall, Dr. Marshall. And, what I loved about your consortium is that you started in churches. And I think it was significant to start at churches and go to the parking lots and actually get the partnership of the clergy, was because, one, that's where a lot of African Americans were, but because in the beginning of the pandemic, there was this rumor that Black people couldn't get COVID. I remember early on in February, wasn't that crazy? People thought Black people could get it. And then all of a sudden the narrative switched to, wait a minute, African Americans are actually the highest rate of COVID, patients. So I know you saw those stats. I know just last week, Dr. Fauci said that there's about 4,000 that we're getting right now at this point. What are you seeing right now with Black, Doctors COVID Consortium? Literally, you're at a testing site. You've been testing since March. How is the continuum? Where is it? What are you seeing on the streets and on the ground?
So in terms
why are Black people so much impacted, by this illness?
Oh my gosh. Okay, so that was 6 questions.
I know, it was. So just
the first thing about thinking Black folks couldn't get it, it was honestly a not a far-fetched conclusion, because what we were told is that it's when you come back from Italy, when you come back from Germany, when you come back from China, when you take cruise ships, and when you're on vacation in February. That's what was told to us, and that it was direct person-to-person contact, not community spread. So when people did occasionally turn on the news, that's what you saw. You saw a cruise ship in the middle of the ocean, You
Right.
saw folks who had traveled to, I won't say exotic places, but other places. And even the first gentleman physician at CHOP in King of Prussia, the cardiologist who had come back from Egypt, and he didn't know, and then subsequently infected patients and all of the staff. That's when it hit. And what ended up happening was it was not a condition of people of means. It was a condition of people who traveled.
Right.
However, in the hospitals and other locations where the people who come from the city to go to the suburbs where the jobs were, then they took it home to their families.
Right.
And because the virus spreads in dense, populous areas, which is what most urban areas are, that's why it spread like wildfire. And so that's where that came from. Okay, now what I'm seeing now is we will probably test 400 people today. I mean, this feels like April and March or April and May, when the positivity rate was like 1 in 4, 1 in 5 people had coronavirus. And then we went through a period in like August, September, and maybe 80 people would show up to be tested. It was like people were checking emails the whole time. We were here, but no one was coming out to get tested. Now what I'm seeing is instead of our population being primarily African-American, it's white, it's Asian, it's Latinx, because so many of the testing locations have shut down because it's cold out. So all the outdoor places have shut down. It's spreading more in Montgomery County. So when you look at the zip codes of the people we're testing, people are coming to find us because we're one of the few people that have evening hours and weekend hours. Because again, we were trying to serve the population of people who are working, who are face front employees. So we're here as the sun's going down, because that's when people get off work. And if you're really trying to serve the people, you don't do it when it's convenient for you, you do it when it's convenient for the community. So that's why we're here. And then same with on weekends. In terms of the positivity rate, the week before Thanksgiving, it was about 20%. It was pretty darn high. Now it's probably, depending on the location, it's 13%, 15%, but definitely double digits.
Yeah. And something that I'm also, trying to understand a little bit about is just that it's very hard to get a test right now. I literally had to get, just inquire. There was a symptom and we knew someone in our, in our workplace that had, and I literally could not get a test within 24 hours. I'm actually still waiting. A lot of people I know are waiting now days when it really took like maybe a day. And that I'm pretty sure is going to impact what you're going to end up seeing, which is why, having, the testing from BDC is so important, just because it's something you can go to, don't have to need an appointment. But right now, it literally is taking a week sometimes just to get a test at one of the pinnacle moments of just the pandemic. And I'm assuming this is the second wave. This is actually a medical question. Are we officially in the second wave of this right now?
Yeah, we are in the peak on top of the peak because of Thanksgiving, because we're 2 weeks out from Thanksgiving today, and we saw a big spike. And in Philly, the spike was 7%. In Montgomery County, the spike was 50%. Okay, and this is my opinion. I don't have any science to back it up, but I think that a lot of people traveled. And this is based on what I see when people come out. But I don't think a lot of people in the city were traveling to Florida and to wherever, because folks don't have money. People are laid off, businesses are shut down. People who are working bars and restaurants are not working, hairdressers, barbershops, and a lot of those jobs where you find African Americans. So people don't have, income to just spend to go to Florida for the weekend, right? Different than Montgomery County. And I live in Montgomery County, so I'm just being honest. And a lot of people said, oh, we're going to have small gatherings. A lot of people said, oh, it's probably not real. And here we are, and I think it's very interesting. And I meant to post this 2 days ago and I didn't. When you look at the peak, that's where the peak is greatest. I mean, everybody has a peak, but in terms of the increase in the number of cases, it's higher in some of the other counties than Philadelphia.
So what initiatives are the city of Philadelphia doing to address the pandemic and the rise? I know that you are an advisor on several organizations, particularly one with vaccines, but definitely wanted to know, is the city doing what we need to be doing? Should we be doing more? Or should we having help from the anchor institutions, the healthcare? Are you getting the support you even need?
I mean,
I know that
you're gonna put me on the spot here, you know.
But we have to know, because this is kind of where we need to be.
I mean, I have my opinion because I see what I see. And for example, no one is supposed to be traveling, but we put a testing center at the airport. What message does that send? What message does that send when in certain communities, there are no testing sites at all, and they're not flying, but they can't get a testing site with hours on a regular basis. But we put together a testing site at the airport like that. Why? Because people are paying cash in hand, $130, $150 for a rapid test, $80 for a PCR test.
Got it.
Okay. And they're paying for it. Yeah. Whereas folks here, if they have insurance, we take their insurance card, but I waive the copay. If I say it's no cost and it's free, I'm not going to charge you for that. So if the test is $125 and your insurance pays $50, $75, I waive. There's no cost, right? For people who have no insurance right now, it's going through HRSA. That is until the money runs out. Right. But prior to that, LabCorp billed me for all. And they said, well, how are you going to pay for this? I said, the test is $150.
Flat. Okay.
People can't, well, it was. Now it's like $225. Okay. But for someone to die because you can't get a test, that they have to wait till they're so sick that they need to be admitted to the hospital. Because remember, that's what we were told in the beginning. You don't have enough tests for everybody. Don't come to the hospital unless you're so sick that you think you need to be admitted. That's when you need to show up. And so what happened, because we were so ill prepared, is that people were showing up and literally dying on the doorstep, dying in the waiting room, waiting to get in, right? And so that's why I said, I'll figure out how I'm going to pay for it later. You know me, I've had my business with you for how many years?
Right.
I want you to bill me. And so that's how that part came. In terms of the hospitals, I think they can be doing more. I mean, I'm not an institution that's been around for 100 years with benefactors and donors and people writing $1 million checks. Like, that's not me. I'm just someone who said, I've been a doctor for 23 years. I've been hearing about health disparities, social determinants of health, that African Americans do more poorly for 20 years.
20 years.
We know the research has been done, but can we implement some of those things that we've learned? So for example, you know, someone emailed me, and it was so precious. Someone emailed me and said, you know, I'm Black, my husband is white. Can he get tested too? And I thought,
right.
I mean, but I said, that is a very genuine and honest question. And I said, absolutely. I said, but the reason why I named this organization, and I didn't ask anyone because I didn't want them to have to answer this question. The reason I named it the Black Doctors COVID-19 Consortium is because the Institutes of Medicine have shown, and most physicians of color know, that African Americans have better health outcomes when cared for by culturally competent African American physicians. That's not my opinion. That's fact. That's been proven over and over. And I knew in the midst of a pandemic, when there was so much misinformation and the mistrust that exists in the healthcare system, that I believed that with a name like Black Doctors COVID-19 Consortium, it might make somebody say, oh, well, if they're Black, then they're probably going to give me a test. They're going to understand when I say my insurance, I don't have insurance because I got furloughed. You know, they're not going to tell me come back another day. You know what I mean? And so That was what was in the name. What we were
Right.
trying to convey, what I was trying to convey is that we as Black healthcare professionals know that it's hard for you to get to the hospital for various reasons, but we are offering this service to you because we value your life.
Right.
And we know it's hard for you to get access. So we're giving you that access, barrier-free, without a cost, and we want you to come to us. And to the person, when I responded, I said this to her in the email. I said why we named it. And I said, but absolutely, we have tested everyone from the beginning and we will continue to do that.
So shifting gears a bit, because we're getting questions, and this is kind of like the latest news. Literally, the FDA is really.
I know. You see, I've been watching.
I know. So have I.
Phone, trying to listen. So I'm missing some for the soiree here.
I know. I mean, like, we've all been kind of on watch because, I mean, this is the day, right? This is the day that the FDA approves either, these 2 emergency vaccines. No vaccine has been approved yet. But if they get it approved, which they probably will, they'll probably roll out the first vaccine before, the end of 2020. We didn't even think that would happen, but it is. They plan to have it widely available in 2021. So maybe we'll all be vaccinated by 2021 at the end. But they're going to start in limited supply. So then, of course, I start to think, well, how are we even going to do this? Should I even trust this? Should I, my family, even trust this? And how is it going to get rolled out equitably? So this was a question that people just wanted me to ask you. I'm asking you personally. I'm seeing it in the chat. Given the above, let's just start with equitable rollout. What do you think of the vaccine? And one, how do you think this should be rolled out and disseminated to everyone so that we are where we need to be maybe by the next year or so?
So so there's 3 phases. There's phase 1A, 1B, and 1C.
Okay.
Phase 1A are the people who will receive the vaccine next week. Those are long-term care facility residents and workers and healthcare personnel in hospitals. And everybody's in each hospital, it's different. So Abington may say it's ICU, it's ER, and anesthesia. Because again, it's a pulmonary respiratory illness that causes pneumonia. So if you're basically putting a breathing tube in someone every day, you're at higher risk. The ER, obviously, because that's your entry into the hospital, and the ICU, because that's where most of the sick individuals that are on ventilators are. So those are the locations. In terms of the long-term care facilities, it's residents usually over 65, 75, maybe 75, and the people who work there. Phase 1B are your essential workers. So if the teachers were still in school, it would be teachers, EMT, firefighters, police officers, SEPTA, the people who drive, SEPTA in the bus. So those are your phase 1B. Phase 1C are people who are 65 and over and comorbid conditions. And that's kind of the group of everybody. So my concerns with the phase 1A is that in the hospital, yes, it's going to be the folks that are most exposed, but that it's also the people who are emptying the trash, that are delivering food in the room, that are transporting patients from, the ER to the CT scanner, the security person that lets everybody in, like those people have to be as important as the doctors and the nurses, because again, they're being exposed. Some hospitals have that down. They have a policy out and they're on it. Whereas I had a nurse, one of my nurses say to me, and they all work at another hospital and then they do this as well, that her supervisor told her that she would be considered in the high-risk group and that yes, she would be eligible for the vaccine. To which she said to her supervisor, well, I'm not sure if I want to get it. And her supervisor said to her, if you get sick from coronavirus, we will not be responsible for you. Now, what in the world kind of response is that? Particularly for someone who's been on the front lines for you for the past 9 months. So I'm concerned about that. I'm sorry, it just said committee vote. I just want to make sure.
Yeah,
I'm
no,
not
no.
missing
Because,
anything.
one of the other things even about the vaccine is that, at least for Black communities, we don't have a history of trusting government issued, types of solutions. I mean, there's been a
Right.
history of,
Right.
Tuskegee, just experiments, like, this is kind of our history of just being Black in America that, I know a lot of friends, very learned and very well read, that are like, I am not doing it. I'm just not. So
Right. And I sort of break that down into 3 groups.
okay.
The first group is, I want it. As soon as it's available, I want it. And most of those people have comorbid conditions, or they work in an environment where they're exposed to virus all day, or they know someone who has been very sick or died from coronavirus. And we know that 1 in 2 African Americans knows someone who has died or been very sick, versus 1 in 10 or 1 in 12 white Americans.
Right.
So that, I think, correlates with how it's affecting your community. So that's the first group. The second group is, I want to wait and see. I want to see how other people do after the first dose, the second dose, and are observed for 60 days to see how they do. And they're kind of the wait and see, but they'll probably get it. And then you've got the folks, and this is sort of my category, who have had coronavirus, and I have IgG antibodies, right? And I'm about 4 months out, and I still have antibodies. And I've been listening to the discussions about it, because how they decided the immunity levels that were required was from testing people who had previously been exposed. So they looked at the convalescent plasma, for example, of someone like myself, and measured the antibody levels. And then they mimicked the vaccine off of that as their baseline.
Right.
And so Dr. Fauci has said, the director of Operation Warp Speed have all said that that was the standard, and even went so far as to say those with antibodies maybe should step aside and let those who don't have antibodies get it first, because we do have some level of protection. And so those are the 3 groups: the people who want it right away, the people who are going to wait and see, and the folks that need more information. So I know for the consortium, vaccine is going to be available on Wednesday. So less than a week from now.
Wow.
For our staff.
That's headline news. That's new news.
Yeah. So I've been talking to my staff. I pushed to make sure they would all get it. I mean, we are definitely in contact, so I don't think anybody would dispute that. But there are some contraindications. So if you're pregnant or trying to be pregnant, you should not receive it. If you're immunosuppressed or you have an autoimmune disease, so HIV, you're on steroids, possibly chemotherapy, and your immune system is very low, you should not get it. And adverse reactions, if you're someone who breaks out in hives or, gets short of breath, has an anaphylactic reaction when you get dye from a CT scan or something like that, you should not get it. So those are the things we know that I was on and read the report. And so I've said to them, I let them know if they want to talk to me, personally about it, that I'm open. I'm going to do a live on Sunday afternoon. I got to basically look at the football schedule and make sure it's not in the middle.
I know, it's a big game. It's a big game.
Oh, really?
Jalen's starting.
What time? So whenever that is, so I'll either schedule it before the game or after the game, so we get the most people. But just to be able to answer people's questions live for like an hour, So I'm going to do that on Sunday. And then I had a interview with the Philadelphia Tribune today, and I told them that if there's a healthcare worker or a long-term care facility, remember, those are the phase 1A people that are feeling like they think they should be getting it and they're not first in line, to call me. Because I am on the vaccine advisory committee for Philadelphia Department of Public Health and CDC, and we set those criteria in a way that you should get it. And so I want to make sure that if you think you should be getting it first and you're not, to use us, to call me, call my office, send an email so we can investigate it further, and if necessary, advocate to make sure you receive it.
Because I think one of the concerns, and I'm just going to take one question real quick, and there's a lot, but I'll take one from the audience because it directly relates to this, is that one person said, my concern is that minorities are most affected by the virus, but they're the least represented in trials and likely the largest portion to receive by mandate the vaccine because of just our high rate of just having COVID. Thank you, Vincent, for the question. What do you think about just that then, Dr. Stanford?
So I think it's really a conundrum. You're absolutely right. But I do think, for example, if I was in the hospital watching colleagues get sick, some of them die, and I had to weigh the risk and benefit, that I would probably take the vaccine, even if there were not enough African Americans represented in the study. Because for everybody, it's a risk benefit analysis. And unless you have some other skill set that now you're not going to be a nurse or a doctor or a medical assistant and you're going to be a pilot, for example, that's your life. So I think for everybody, same with when we get to phase 1B with the SEPTA workers, if what you do is drive the bus and that's how you support your family and that's how you're going to get your pension, and you're exposed every time somebody gets on the bus, now you can't open the windows, right? Now people aren't sitting as far apart and you can't do something else, then for you, the risk is worth the benefit because that's your life and your livelihood. So yes, I agree, wish there were more African Americans in the study. Yes, I agree, I wish we had 4 years to follow this and to say it's safe. We know the intermediate effects. We know the the intermediate effects, we know the immediate effects, but we don't know the long-term effects. And that's true regardless of what color you are. So it's a bit of a step out on faith because
it is.
No amount of the emergency use authorization, this meeting that's happening right now, is gonna give us what are the long-term side effects. We don't know.
And I think even President Obama and I think even President Clinton has said that they would like to take the vaccine live just to kind of show people and be an example, which I actually think is honorable. Because I think there's this notion that, as long as people who are important take it, then I'll take it. And I understand.
For some, but for others, it's their barber, it's their block captain, it's their pastor, I mean, for some, that's going to matter as much because that's someone I interact with every day. That's someone I know is real. And so it's a magnificent experiment almost, if you will, in human behavior and trust, how people decide what to do. And it is such an individual decision for every person. Like, I think that my husband's going to take it, but if I still have antibodies, I'm not. And so even on our team, there's 70 of us and half of us may take it and half of us won't. So
we'll have to see. I mean, and again, I think there's a lot of hospitals, even I know that someone just said in Duke University, they're waiting. They think they want to just tell their people, they want to just hold off until more information is known. So there's going to be a lot of interesting opinions.
Oh, wow. I'm just reading some of this too.
Yeah, I mean, this, I think we're all about to start in the new year, start to have this risk benefit that you just said with our families, with our coworkers, with everyone. Like, what are we going to do as a family? What are we going to do as an office, a business?
Right. And that's why I'm hoping that people, can join in on Sunday and really ask these questions. And I think if you've had coronavirus, it's worth getting your antibodies checked. It's worth it. I mean, because we started testing people for antibodies that were positive in April. So we tested them at 3 months, we tested them at 6 months, and now December will be 9 months that we have our antibody group that we're going to start testing. And at 6 months, 85% of the people we were testing still had antibodies. So,
Well, let's well, what if if we're forward thinking, what if we're now in 2022, right? And most of the population has had, vaccine, or their antibodies have definitely been measured. We're having this herd immunity happen that everyone, including Dr. Fauci, says is needed for the virus to start literally dying out. And we're, at the end of 2022, when we can go back to a concert. When we
Dang, 2022. Woo!
Well,
I thought you were going to say the end of 2021.
We'll see. I mean, we'll see. It's a grand experiment. We're really going to see the world.
It's dynamic. It's constantly changing.
But after it all settles down, where is the Black Doctors COVID Consortium?
Wonderful question.
Taking out COVID-19. Just saying, where is the Black Doctors Consortium?
Beautiful question.
Where can we see you? Are you building health centers?
Yes. If you had asked me this question in May, I would not have had an answer. I definitely do. So, as I mentioned, I've been a surgeon for 23 years, and I've had this awesome career, particularly of operating on children, that I now see in the grocery store, and their parents were like, Dr. Stanford, it's me. Remember Justin? You operated on him when he was, 1. And it's so beautiful. And they're waving, and I'm thinking, okay, I guess, and sometimes I recognize moms. And so I'm at this point, and I was already at the beginning of this year, because I'm 49, everybody starts having the, what do you do next in your life? Mm-hmm. And I was already having do I go back into academic medicine, CHOP, St. Chris, whichever, or do I pursue my concierge practice, taking care of 5 families, for example? Because I've operated, it's been phenomenal, but it's okay to go a different path. So I was leaning towards the building my clientele with the concierge, and then COVID happened. And I guess God said, no, you're not gonna do that, right?
Not solely, not exclusively.
Right, not exclusively. And so Black Doctors COVID-19 Consortium, my plan is that as COVID is no longer COVID, that we just pull COVID-19 out of the title, and it's Black Doctors Consortium. Absolutely. And that we are a health advocacy firm, that we have a free clinic. I'm going to call it free office hours for people to get second opinions, for you to have, that lump examined that's on your back that you just always wanted to know, should I be concerned if this is cancer? And do that. And being able to get my friends that are phenomenal in cancer and prostate disease and colon cancer and all of these things, and really work on changing the narratives that African Americans have poorer outcomes in every disease process that exists, right? And use the latter half now of my career to focus on that. So that is what has evolved for me. Surgery is always something that I could do all day, every day, don't need sleep, always excited to do it. But this also fills me the same way.
I see BDCs across the region, and I'm just starting there because we need it definitely in this region, but you could literally have different sites across the country, Dr. Stanford. That's where I see. That's your next chapter of just where this is. In addition to Patty LaBelle, because I saw that you were at the house preventing to make sure that her family was okay for her concert. So you can Patty LaBelle.
Everybody needs a COVID test, and those are the types of things that I was starting to get into with different movie sets, is getting people cleared. So for Will's Jump, for example, everybody had to be medically cleared. You can't be the pilot, flying Will Smith as he's hella bungee jumping out of a helicopter and not have a clearance for, your medical and, psychiatric and all that stuff, your blood pressure. And so those were the types of things I was doing, because you have a site doctor every time there's a movie. And so I love that, because it's a finite period of time, you get things going. But there's other people that can do that. And
Right.
I believe my voice as a physician scientist, because again, I was in the lab doing PCR, doing flow cytometry, doing cell cultures, and all of that throughout my training. And so I understand the conversations about mRNA and RNA and reverse transcriptase and being incorporated into the genome and all of that. Like, I get it. I love it. It's fascinating. Like, I wish I could have been in my pajamas doing this all day. So, but then I'm also, this is my community. Like, we're in Germantown and I went to school around the corner from here. And so, but I can also relate on this level. And that, I think, for me is a unique place to be, that I'm relatable and trustworthy in the community, but I can also be at the table where decisions and policies are made. And I recognize that unique niche and I like it.
The last question that I have, because we need to get you back to testing, but because we are at a Woman in Tech Soiree, and this is an innovation technology community, we have to ask, what is the role that technology is going to play? Because it definitely is starting. We saw telemedicine accelerate completely. We're in the Philadelphia region. Before you jumped on board to the event, I was literally saying that we're in our Michael Jordan moment, quoting someone else, but we're in our Jack moment of just like where the city is in terms of about to jump off into the bio explosive digital health innovation and life science sector. Like, we are, Philadelphia was part of the vaccines. Like, we're in this. So
absolutely.
You know, where do you see this all fitting with your work, your vision, and just the region in general?
I mean, I think we're going to learn so much from this. One of the most fascinating things for me that I wish had worked well, but again, human behavior will supersede everything, was the NFL having those chips for contact tracing and getting tested every day. I thought was phenomenal that when one player was positive, they were immediately able to see who that person was in contact with just by clicking the number on the chip that you had. I mean, it was phenomenal. So that's how they were able to get everybody out and not have it spread more. Now, imagine if we had something like that. But again, in America, and that's part of the reason why this pandemic is so pervasive, we all want our independence, we want our freedom, we don't want anyone to be governing what we're doing. But in China, again, technology, they had drones. And in your license, which we all have chips in our license. If you left your area where you were supposed to be, as we were supposed to be, safe at home, sheltering in place, all those terms, a drone would announce, "Ayla Stanford, you are 20 feet out of your blah, blah, blah," and direct you to go back into your house. Now, in America, we would never want it.
Oh my goodness.
Tolerate it.
The protest alone for that.
People are already like, it's my civil right to not wear a mask. I mean,
I know.
So, we wouldn't, but again, the technology exists for all of it. But as I said, human behavior supersedes all of that. Absolutely. And so even the fact that in the UK, they were able to roll this out so fast, because they have what people don't like, the socialized medicine or the unified medicine or whichever. But what it allowed is for you to get everybody that was registered to say, okay, you meet criteria, you meet criteria, you meet criteria, and for them to show up at a location and get their vaccine. And we don't want that, but then that's what makes some things logistically so challenging. And so to your point, it's not that the technology doesn't exist, it's how willing are we to incorporate it into our lives.
Yes, ma'am. Well, on that note, oh my gosh, Dr. Stanford, you are, so literally I'm getting texts like at least you accrued at least 3 interviews, magazine interviews from people that want to talk to you. I'll connect with Kamal. Thank you, Kamal, for again, introducing and facilitating your sister's appearance. Definitely, we are so grateful for you, for your work, for your just your integrity, for your honesty, and just for who you are as a woman, as a physician, and as a woman of color who are really trying to make the world a better place. If everyone needs to reach her again, we can send information to you, but we just want to say thank you. And again, this event, this entire event, all the ticket proceeds are going towards your work.
Thank you so much.
It is going to the work of the Black Doctors. I'm just saying consortium, because at this point I see the center. So however it can go to the support what you're doing. We love you, we support you, and just know the innovation economy is always behind you for Philadelphia. And again, I know we didn't get a chance to answer all the questions, but please, I will definitely pass them on, and she will definitely.
Yeah, if you save the chat,
yes, ma'am.
You email it, maybe
Yes.
on Sunday,
We can do that.
if I have some sort of.
Oh yeah, during your live, yes.
Yeah, I could
We'll do
answer
that.
them if
Perfect
you send
idea.
them to me. That would
I
be
will.
great.
We will send it. Absolutely.
Okay.
Absolutely. Well, God bless. Stay safe. Please. Thank you to everyone at Max Street Charter. And we'll see you on the other side.
I was about to take my computer and show you what it looks like, but it's pitch black outside. You can't see anything.
Is the line long?
Yeah, let me see if I can. Oh my God.
We'll see it. Because when I went to Salem,
all I see are lights and.
Wow.
Yeah, it's yeah. You see the lights, but people are wrapped up around the block. So
I believe it. This is the time.
Yeah. When we tested at the Leah Corus Center,
yeah,
it was we tested 730 people.
Wow.
Can you imagine? 700. And
wow.
We also gave out flu shots. So if you haven't gotten your flu shot, even though it's
true.
late into flu season, please still get it, because the combination of the flu and COVID is not where you want to be.
Absolutely.
But yeah, so I just keep talking to LabCorp, like, listen, the demand is high. So we're just try our best.
We will totally send you the chat recording. Absolutely.
Thank you.
And
enjoy the remainder.
Thank you so much, Dr. Stanford. God bless. Thank you. Well, I think that was probably one of the most insightful just interviews that I've ever done, particularly just in my tenure with the Women in Tech Soiree. Love that Dr. Stanford was able to take some time. We are now going to break for a little bit of an intermission. And again, before we go, we would love if everyone wants to see the videos. The next panel, of course, is the Launch Lane panel. Yay! We've been excited to see this exuberant and entrepreneurial group, but we are about to show the videos of the group so that you all can get a chance to have a little bit of an eyesight about who they are before we begin. So please stay around, but if not, enjoy stretch. We'll come back at around 5:35, really right after the videos are over. So I think we're about to show them now.